Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hello there. Happy Sunday, and whatever day that you are watching this and looking in on me to see what I'm up to these days. I am Dr. Mary Ann Pinkston, a family practice doctor here in San Antonio, Texas. And I have so many different hats that I'm wearing these days. I'm really having a great time with this show. I certainly appreciate everybody who has been listening in and subscribing. I would love for you guys to share and subscribe and help me kind of get the word out. I've been doing a lot of guests lately. I think when I started this program, what I wanted to do was talk about a ton of topics that I think most people are interested in to improve their life and better their health. And so what happened was, though, I got a lot of interest from the community and around, a lot of support, and started having a lot of guests on my program. So I've had a lot of interesting and inspiring stories, and I've got more to come. I'm so excited. So please keep tuned, and I will have a lot more. Today I'm going to do it solo, though, because I have something I'm fairly passionate about that I think many, many people have a lot of questions about, a lot of myths, and so I want to clarify a few of those things. Before I do, I'm going to give you my website. It is drpbetterlife.com, and there you can find my YouTube channel and all of the podcast links. I'm on iTunes and Spotify and Amazon Audible. You name them all. They're all there. So drpbetterlife.com. That will help you hopefully look things up and share me, please. So the topic I want to talk about today is CBD. So CBD, again, has become more accepted in society as far as a medicinal, something we can use, something natural. A lot of people are still stuck on the fact that it comes from either the hemp plant or the marijuana plant. And what people don't understand is that hemp and marijuana are two distinct things, but there are many pieces of the plant that make it medicinal. And it is not just something that blooms and flowers and we take that and take all the THC, and that is the psychotropic drug portion of it, package that up and market that on the street, illegally for now, of course. But there are many other parts of the plant that are very useful to our bodies. So it is not a drug. It is a natural supplement herb, however you want to classify it. And if you look at the way nature made the plant, so the plant grows, and it's all CBD, CBG, and lots of other, again, medicinal things that help to improve our bodies and our minds and how we function, and inflammation and anxiety and sleep and all those factors. But when the plant actually matures and blooms and flowers, that is the part that becomes the drug. And so that is the part, as I say, is mostly farmed and sold illegally. But the rest of the plant is not. And even THC, which again is the psychotropic drug portion of it, even THC has some purpose to its ability to treat certain problems, especially chronic pain, which is legal in Texas. A very small amount of THC in medical marijuana, and it is available in Texas. You have to go through a place in Austin called CompassionateCultivation.com. And there are physicians that are associated with it that they will refer you to. They do a prescription. It can be done over a telemedicine or a Zoom type of meeting, and then you can get your prescription. So you can be in San Antonio and see somebody in Amarillo and get your prescription, but you can also keep your primary care physician or your pain doctor or any of your other doctors that you have if they don't provide this prescription. So it is in very small amounts, and the point of using THC, if you use it, is to mix it with a higher dose of CBD. So a very high dose of CBD and a very low dose of THC, and those two combined have a very synergistic effect. They make each other stronger. And their purposes for, again, pain therapy, improve sleep, anxiety and depression, people who have neuropathy or psychological disorders, Or if you don't have a psychological disorder, you just, are anxious about life and having trouble sleeping, this is a very, very appropriate therapy to use. So the problem is that there are thousands, if not hundreds of thousands, of different brands on the market. So who do you buy? Where do you go? Where do you get your research from? And that's what I want to spend a little time on today, because I've tried over the last probably 7 or 8 years to understand this as it has come to market and grown, and now it's so huge out there. Now everybody's really confused. So the CBD market is interesting because anybody can do it. Anybody can grow it in their backyard or, buy a field of it. You can buy it from anywhere, any distributor. And the problem is that it really matters what strain it is. I think there's over 1,700 strains. Somebody can correct me on that if I'm wrong, but there's over 1,700 strains. So it really matters what strain it is. It matters how it's grown. It matters how it is, cultivated and processed and distilled, and how it's stored and shipped. So there's so many different factors that play a role. You really have to be careful. So if you're going down to your local supermarket or gas station on the corner that also provide it, or you're reading something on the internet, anybody can put that it is high quality, that they have what's called a white paper. Most people don't really have that. So if they see that, you should ask for that. That explains everything about how it's grown and processed and shipped and everything. Yeah, the strain, it has all that information on it. And so when you have that, white paper and that information, anybody can put on a website that it's high quality, that it is effective and safe. And so you've got to be very careful about those keywords that they use in commercialism to draw you in, because most of the time it is not. It is a filler of some sort of oil and heavy metals. So a lot of these CBDs are loaded with heavy metals and don't actually have the right part of the plant. The cheaper version, sometimes they say you get what you pay for. I don't believe that in this case entirely. But most really good CBDs are $150 for a very tiny bottle. You use only a couple of drops. It's very, concentrated. So, there's so many pockets that you fall into and dangers that you fall into on choosing it. So who better, right, than to ask your local doctor who has a lot of information, has studied a lot about it. And I have my own resources. I do have Tina Peterson, who is here in town in San Antonio, that can be reached from anywhere. She has a company called Restore. And she is backed by my own physician, Dr. Pendleton Wickersham, who I think is just the most wonderful person on earth. And they have conspired to put together an amazing product. So Restore has a great CBD, CBG combination. They have, gummies, and they have a topical. And so all of those are wonderful. So I'm going to have all that information on my website for you to access. I do, and all these things I don't make money off of. I really like to support people in the community who are doing the right thing. And I've had great luck and results with this. I do have another that I support, and I have invested in it a little bit. I don't make a huge amount of money, but I do want to disclose I do make a little off of it. But I do that because if I'm involved in it, I'm able to get you a much better price. And this one is called Sealy, and it's Cili. So Sealy came into my life as a surprise by my friend JJ, Jennifer Jones, who is a nurse who has incredible background on CBD and has studied very well. She and Tina both are my great resources. And JJ has been on my show, actually, and I'm hoping to drag Tina on one day. But JJ and I have, studied and talked a lot about CBDs, and Sealy has a wonderful brand. And what I love about it is it has no THC whatsoever. And it is processed in nanotechnology. So that's kind of the new buzzword about, vitamins and any sort of medicinal products, but nanotechnology. So they're able to put a fat droplet in a water droplet. The other thing that they're able to do is use CBD and CBG and many of the other isolates of parts of the plant that do provide that medical, therapy to patients. But they also include a wonderful amount of vitamins and supplements. So they use things like ashwagandha and curcumin and all those other buzzwords that are out there. So it treats your cortisol, it treats sleep disorders, it treats pain. Very, very effective. It has some regular vitamin A's and things like that in it as well. I've got a great list that I'll have on the website as well. They also have some little individual sprays for curbing appetite, for better sleep, for energy. So the Sealy, though, Swish, is a huge bottle and concentrated, nicely dosed, and a huge bottle is about $72.50. You can do sort of a membership. You're not joining a weird club or anything, but you can do sort of a membership and get it for $50. So compared to those $150 out there, absolutely amazing price for the quality of a product that you're getting. They do have a white paper. I have all the studies, all those things, so I can assure you that you're getting something quality. The THC was bred out, and this was bred out in the UK. And so Brad, who owns the company, has gone all over the world and looked for a completely wonderfully derived product that has everything you need in it. And so it makes it fairly simple. So Sealy is a brand. They're very limited on the amount of things that they have, which I love. It makes it a single, shot to just go on and order. When you order, you can sign up and do some auto ships and things like that. Like I say, these are not things that you have to do. You're not giving away information you don't want to give away. We don't bother you with a lot of emails and stuff. It's not a club, so that's not the purpose. The purpose is to get out good information and a good product to people that actually works. I think the thing that I noticed the most about it, so I'm a doctor, I'm a single mom, I have 1,000 things that I do, and I don't sleep well. I have a lot of stress, so it's good stress, but I have a lot of it. And I get anxiety too. I think everybody does that. It's a normal part of being a busy person. But the other thing that happened is because of my stress, my adrenal glands, or the glands that produce a lot of cortisol and cause a lot of stress, it causes significant thyroid dysfunction in patients. So I lost a tremendous amount of hair, lost my eyelashes. And so hence the reason why if you guys are always looking at my little eyelashes here on YouTube, you can see I usually wear the fakies, but I did that because I lost everything. So I have been using the Sealy product for quite some time now, and I have had significant results, as others have, in hair growth, nail growth. My eyelashes came back like twice as thick as before. So this is something that I believe in now. When you're passionate about something, it's very easy to talk to people about it. And I am very passionate about it. CBD is something that I think has been shunned for a lot of reasons, seen as a drug, viewed as a drug. Back in the 1930s, the American Medical Association and doctors, physicians were actually behind the use of THC and CBD. Back in the 1930s, there was a push during that time it's kind of like a lobby minefield back then for CBD, that it became something that was made illegal, a THC was. And since then, we have battled the ability to go back and bring it back as a great medical product and a therapy. The AMA back in the 1930s was actually for CBD. Doctors were all for it. So it's very unusual how it got canned at the moment and thrown to the side, and now we've battled almost 100 years now to bring it back as something that medical that really does help people. So I really want to open your mind to it a little bit. I'm going to leave some information on my website, so drpbetterlife.com. I'm going to leave information about Sealy so that you can go look at it, and Restore as well. I always like to give people two options. I know I benefit from one of the products. That's fine. That's not something you have to do. I want you to have good choices. Tina and Dr. Wickersham have put together an excellent product. I actually use both, so it's hard for me to choose between the two things. But I'm going to leave all that information on drpbetterlife.com. One of the things that I want to talk about as I'm going to near kind of the first half of my show here, and I want to talk about a few things after I get back, so please stay tuned after the break. But one of the things I will talk about CBD-wise is the parts of the plant and the isolates that make it a therapy. So patients are like, all right, well, what is CBD? Why would I use it? I know it's for pain. I know it's, for all of these things. Why does it work? So your body, we have millions, trillions of cells in our bodies. every one of our cells has CBD receptors on them. So we actually have more CBD receptors on all of our cells than we do actual cells in our body. So if you were ever looking for something natural for your body and something that, it was meant for us, I think that look no further. This is something that has been around for a very, very long time. And again, we've known about it in medicine for over 100 years. And so having that many receptors in our body, you would imagine that this would be the perfect therapy. Patients who benefit from it the most, in Texas, again, legalized with the medical marijuana, the THC combined with the CBD, is for neuropathy, mostly patients who have that burning and stinging in their hands and feet or other places. Neuropathy does very well with CBD and the THC combinations. Patients who have migraines and chronic pain. We are even using it in patients who have pain with ALS or multiple sclerosis. There's a lot of autoimmune conditions that patients can take it for, even in the line of rheumatoid arthritis and whatnot, which is not really on the list of where we use medical marijuana, but CBD is. And CBD doesn't only treat pain, it treats a lot of emotional and functional issues that patients have. So if you do have anxiety or depression, if you do have the inability to sleep well, anxiety early morning, we can use it in children. We can use it in the elderly. I know that there are people who have, used it during pregnancy, and I caution every pregnant woman, there is no studies in very, very young children and in women who are pregnant and their infants, but there, again, it's made for our bodies, so it's easy to think that would be something we could use. Always, please, check with your physician. I am a physician. I do recommend it, but I always want you to be honest and talk to your own physician about what you're using. There's a lot of varied opinions, so you may not get the answer that you want, as in, the yes that you want. But if you have any questions, I do answer the questions. I don't give medical advice directly, but I'm always happy to answer questions. And so if you go to drpbetterlife.com, you'll see my email, my contact information. So contact@drpbetterlife.com, and I'm happy to answer those emails. We're going to take a short break. When we come back, I'm going to talk a little bit more about CBD and some of its medicinal purposes. Thank you. Hello there, I am back and been talking about CBD. CBD is something that I think a lot of people have a lot of myths and built up about it and are concerned about use, have a lot of questions. Maybe there's not any myths, but you just don't know how to use it. And so I wanted to clarify a few of those points today. One thing I want to clarify is how to use it. So when you get a CBD product, you always look at the label, and it has a lot of information about milligrams, and it's split into how much is hemp and how much is the concentrate, how much are isolates and all of that. So I can't really speak to milligram dosages for every individual and for every individual problem, because we would be here all week doing that. But I will tell you, studies generally have shown that 12 to 25 milligrams twice a day is what is ideal for many problems. Now, to think about it, though, in terms of the way we look at a lot of medications and therapies here in America especially, is that if a little bit works, well, then a lot's going to work better. And CBD is a modulator. So it means that if your body is overactive in something, so overactive in inflammation, overactive in pain, overactive in whatever is going on with you, then it will bring it back to normal, make your body and cells function normally, your immune system, whatever. If your body is underactive in something, then it will bring you back to and modulate you back to a normal status where your body again is functioning normally. So as a modulator, more is not necessarily better. So in the Sealy product, for instance, I have patients take a full capful when they get it and load their system and load all the receptors, kind of wake them up. And then I have patients back down to about a half a cup full twice a day to start. It takes about 3 to 4 days. Sometimes the patients notice right away the effects, good or bad even, which is rare to have anything bad. But 3 to 4 days is what typically will allow your body to feel what is gonna happen. If in 3 to 4 days you don't notice any improvement or change in what you're looking for, then I ask patients to try to either drop down on their dosage or go up a little bit. Don't go up a lot and don't go down by a lot. CBD is something where you have to find your own therapy and your own sweet spot. And there are times where I can give, patients and people a little bit of advice about which way to go with it. But with the dosing and asking you to go up a little, well, you can continue to go up a little or down. So what you would do though is if you get too much for some reason, say you're way too sleepy or too up and too boosted, you can leave it off for about 3 to 4 days, clean out the receptors again, and then start all over and change up your dosing. I say if you're too sleepy, back off. If you're too boosted, sometimes go up. So again, it's very reverse thinking, so you have to play with it a little bit. You're not going to be drugged, so you're not able to operate machinery unless you're sleepy, so try it on the weekend just to make sure. But it's not a drug, so you're not going to be affected that way. And it's certainly not something that's going to pop up as if you're using CBD only, especially like Sealy and other products, you are not going to test positive on a drug test. There are some people who do, corporations who will test for CBD products, but it's actually very rare, and most people don't really care. It's the THC, especially in Texas, that we're testing for. And so if you're not testing positive for THC and you're using this product, well, then you're not going to be denied your psychiatric medications or your pain medications when you go to your psychiatrist or your pain doctor. A lot of patients are very scared about that, or get fired from your job. You can also get a note from your doctor that says you're using this, especially if you're working with your doctor on it, that says you're using this for a medicinal purpose, so that you don't get into trouble, so to speak. But it's not a drug, so you shouldn't have to fight that battle. And, just looking for something affordable, looking for something that works with your body, a dose that works for your body, something that has, good amount of science behind and studies behind. That white paper is very important. Something that you can count on and something that your doctor recommends, something that Dr. Pinkston recommends. Those are the things that you definitely want to go to and look for. So again, I will have all this information on my site, and drpbetterlife.com is where you can find all that information. You can also find information about my sponsor, pdlabsrx.com. Ray Solano up in Austin, who's on every third Thursday, is with me, and we talk a little about amazing topics and supplements and things that they provide. So you can find his information as well. I'll tell you a little bit about me. I am in Northwest San Antonio on Shanefield Road. So Shanefield and 1604, for all of you guys that know the Exxon and the McDonald's, that's on the corner, that's Shanefield. And just go up the road, and I am on the right-hand side in a little yellow shopping center way at the back. And my number is 210-698-7825. I do see patients. I do take new patients. We see patients with insurance, without insurance, and believe it or not, without insurance is very, very affordable. I can even get you a wonderful lab panel. Again, I don't make money off of that. Star Clause don't allow. So those things are honest, and the intent is good. We can work you up for all these difficult problems that you may be facing and questions that you have. I do disease management, I do wellness, I see kids, I see elderly, I do the whole gamut. Wellness is where I really enjoy. I'm an integrative doctor as well as a family practitioner, so please come see us. And PinkstonFamilyPracticeSA.com is where you can find information about the practice, and email and call the practice and find our map. And then drpbetterlife.com is where you can find everything about the show, YouTube, iTunes, and thank you for listening on 9:30 The Answer, and you guys have a great week.